Good morning, everyone. This is Kim Fleming again. We're here for the webinar, New York State of Health, the Official Health Plan Marketplace. And our presenter has arrived, and the roads are crazy out there. I know I've heard on the radio warnings about icy, and I understand you're on Route 79, but Kelvin has made it, and as we promised, we'll get started. There you go. Thank you. We're going to get started right away. I do have your phone lines muted, so this is a sound check for people. You should be able to call into the conference call directly or through the computer. So we've got you muted. We can't hear you on the phone, but we do welcome you to join into the chat box. Send to everyone if you have a general question, or you can send right to me. This is Kim Fleming. I'm professional development here in Cornell Cooperative Extension, although I'm working through the chat box on Sarah Dayton's line, as I mentioned earlier. So don't be confused by that, but we'll respond if you need something to me directly, privately. I can do that, or feel free to chat right to everyone. So I'm going to welcome Kelvin Sapp, and Kelvin, I'll let you introduce yourself and then go on with the presentation.
All right. Well, good morning, everyone. Sorry again for the delay. I do respect your time and appreciate your joining us today. As mentioned, I'm Kelvin Sapp. I work in the External Affairs Outreach and Marketing Department for New York State of Health. I joined the team back in May, this past May, so I've been on board for just about 6 months. And for the most part, I am responsible for outreach for upstate New York, but I do travel to New York City, and I'll be on Long Island next week, so I'm on the road quite a bit. And again, just really glad that you all are able to join us today, and I look forward to hearing some of the great things that you're doing to help get the word out regarding New York State of Health. With that, we'll go ahead and begin. I was planning to start by showing you a short video. So if you have handouts, you see a black slide. That was a placeholder for our mantra video, which was just a short clip just to give you an idea or a sense of the feel of the campaign. But for time's sake, we're going to skip through that right now and just move ahead. As you all know, New York State of Health opens its doors officially for enrollment on October 1st. Prior to that, you know, there's a lot of that went into, of course, building this huge effort in terms of the IT infrastructure, which is a huge, huge, huge undertaking, but then all of the other things that went into, you know, plan management and plan development and rate setting and all of those sorts of things. And so we're glad to say that we're open since October 1st, and things are moving along just fine here in New York State. All right. So the marketplace was designed to be, and we refer to New York State of Health as the official health plan marketplace for New York State. It was designed to be a one-stop shopping experience where individuals can obtain subsidized and unsubsidized coverage. This is a place where they can easily compare the various health plan options, and is in fact the only place where individuals and small businesses may come to apply for financial assistance to help pay for the monthly premiums and to access the federal tax credits and also some cost-sharing subsidies that are available. I'll speak about that a little bit more as we go along. In addition to individuals being able to enroll in Medicaid and Child Health Plus through New York State of Health, they can also enroll in one of the qualified health plans that are in the marketplace, and also the dental plans that are available. The marketplace is designed with two programs or two components. We have the Individual and Families Marketplace, where again, individuals and families as well as sole proprietors can shop for coverage. And in today's existing market, you will see that sole proprietors shop in the small business marketplace. So that's something that's changing. They will shop in the individual marketplace, and primarily because it has been determined that that's more beneficial for them. And then there's the small business marketplace, and by small business in New York State, we're talking about businesses with 2 to 50 employees, so fewer than 50 employees, but not a sole proprietor. These are the individuals, or these are the small businesses that can shop in the marketplace. So just like the individuals may come and obtain tax credits and cost-sharing subsidies, small businesses can come to the marketplace and also obtain federal tax credits if they qualify. Again, this is the only place where they can get those credits. And trying to understand just who we could expect to enroll in New York State of Health, the department contracted with an organization called the Urban Institute and had them do a little bit of research to help us to understand who we should expect to come to the marketplace. In so doing, we've learned that over the course of the first 3 years of New York State of Health implementation, we expect about 1.1 million New Yorkers to come to the marketplace. The bulk of those will be in the individual and families marketplace, about 615,000, and then we expect about 450,000 of those enrolling coming to the small business marketplace. And for the small business marketplace, we're thinking about an average of 4 to 5 employees for those small businesses. So we're talking about approximately 100,000 small businesses. Some of the other information, and this is by no means an exhaustive bit of the information that we got. These are just some pieces of information that I thought might be interesting for you today. In terms of race and ethnicity, you can see that in both marketplaces, about 56% will be white, non-Hispanic, which means that we have about 40% roughly that will be from another race or ethnicity. And this is significant because it informs what our outreach should look like, the materials should look like, all of these various things. Languages, you'll see in another slide. We'll go ahead and move ahead. You see income characteristics. I think maybe the next slide we'll see something about languages spoken. But in terms of income, again, you can see that we have quite a few people, roughly 86% or so, I think, that will be at or above the 400% of the federal poverty level. And again, that's significant because we expect that those who are at or below 400% of the federal poverty level might qualify for some form of federal tax credits. So again, but this helps us to understand, again, who the people are that are coming. We'll move on to the next slide. Okay, here's a broad one about language. So about 63% in the two marketplaces will speak English as their primary language, but again, we've got about 36% who will speak a language other than English as a primary language. And in the next slide, I believe you'll see a little bit more of a breakdown of those languages. And so here you see it, again, 64% English. We've got about 18% who will speak Spanish. Then we have Chinese, and so forth and so on. And again, all of this is very important, and you'll see why, when I start talking about the materials that have been developed and the language access services that are available through our customer service center, through the individuals that are on the ground to help people to enroll. All right. And this next slide just shows a little bit about the level of educational attainment for those who will come to the marketplace. And so in the individual marketplace, and not a huge difference on the other side, but you see that only about 36% have a high school degree, 24%, about a quarter, in the individual marketplace who are college graduates, about a little bit more in the small business marketplace, about 31% have a college degree. But again, all of this information is very helpful as we develop this program, develop our materials, et cetera. So I've mentioned some of these things. We expect that about 75% of those who will enroll through the marketplace will qualify for some form of tax credit to help pay for their coverage. Nearly 35%, again, will have a primary language other than English. And we've talked about the racial, ethnic background, and also the average small business will have about 4 employees. Okay, so open enrollment began on October 1st, and it is important to note that the first open enrollment period for New York State of Health is a 6-month period running from October 1st through March 31st. So October 1st through March 31st is the first open enrollment period for New York State of Health. Individuals not qualifying for or enrolling in a plan within this time period would have to wait until the next fall when the next open enrollment period would begin, unless there is a qualifying event such as marriage, loss of coverage, birth of a child, those types of things that would initiate a special enrollment period, open enrollment period for that individual. Individuals enrolling in Medicaid and Child Health Plus can enroll throughout the year. And as is currently the case, those enrolling through a small business can also continue to enroll throughout the year in line with what their small business has set up for enrollment dates. Excuse me, we'll continue on. The department also enlisted the services of Wakely Consulting Group to kind of give us an idea of why the marketplace might be attractive to small businesses. You can expect, as you probably know, the small businesses, again, I've defined as 50 or fewer employees, are not necessarily required to provide insurance for their employees, but many of them do. And so for those who do, and many of them are using insurance brokers, et cetera, we just wanted to kind of get an idea of what would make this appealing for them. And so this is just, these are just 4 of what we call the value propositions, things that they thought would make this more attractive. So in terms of choice, the small business owners have the ability to choose. Basically, it's an open choice model in the sense that they can select a particular metal level, and I'll talk about those in a minute, but a particular level of a plan, and then all products within that particular level, or they could select a specific health insurer and a specific product offered by that insurer. They can select one specific insurer and offer multiple products from that particular insurer, or they could select, excuse me, all metal levels and all insurers. And so they have a little bit of choice in terms of how they're going to make coverage available to their employees, and that's something that they value. Also, the marketplace will handle some of the administrative functions, so the backroom administrative functions like monthly billing for these small businesses, and so that's something that's also very attractive to them. They don't have to worry about dealing with those aspects. Again, I've mentioned that the small businesses can come to the marketplace to qualify for tax credits. Not necessarily every small business will receive tax credits, but for those who qualify, this is also something that's attractive. And then they have different contribution options, so they can decide that they are going to give X amount of dollars per month towards coverage, and then the employee, and then say to the employee, you can pick any plan, but if you go over this amount, then you're responsible for the difference, whatever. So they get to decide, and that's valuable to them because now they feel like they have a better idea, a better handle on their finances for the organization, for the company, and they can predict their costs a little bit better. So with the open enrollment, we have a state-of-the-art website or web portal that has been designed to make it easy for individuals to shop and compare the various plans and options, and to actually enroll in a health plan. Again, this one web portal will allow us to look at Medicaid, Child Health Plus, the qualified health plans that are in the individual marketplace, and those that are in the small business marketplace, and again also the dental plans. So this one web portal will be, this is where I talk about the sort of the one-stop shopping experience. They can shop for all of these. So the days when people have to go and stand in line at DSS waiting to try to enroll in Medicaid, they can do this all right here from the comforts of their home or somewhere in the community. Accompanying this this web portal, we also have a first-class customer service center that's operated by Maximus, and they are available to answer people's questions, but in addition to that, and probably more importantly, they are available to actually help individuals enroll. So you can actually enroll sitting at your kitchen table by speaking with one of these representatives over the phone. They can actually complete your application for you. And I will give you the hours and the phone number for the Customer Service Center before we're done with this call. In fact, I think it's on the next slide, that information. So the call center is operating right now from Monday through Fridays from 8 a.m. until 8 p.m., and then with limited hours on Saturdays from 9 a.m. to 1 p.m. So these call center representatives are available, again, to answer questions and to complete applications for individuals who are prepared to do so. Many of the representatives that are answering these calls are bilingual or speak multiple languages, but we know that we have over 170 languages that will be spoken or whereby assistance will be available. We have a contract with Language Line Solutions to make sure that, if there's a language spoken or not spoken by one of our call center representatives, the individuals calling in for assistance can still get their applications completed or their questions answered through telephonic or oral interpretation services through a language line representative. Okay. We talk about so in terms of people getting enrolled, we have the web portal, we have the customer service center that I've mentioned, and then we also have individuals in every county of the state who are on the ground and ready and able to answer questions and also to help people to enroll. And so I'll talk a little bit about these different types of in-person assisters, if you will, that are in the community and just what they offer and kind of where you can find them. All right, so the three types of in-person assisters. We have in-person assister or navigators, which you've probably heard of by now. Navigators are organizations and individuals working for those organizations who are under contract with the state. So state gave out about, I think it was $27.3 million or so to organizations across the state, specifically to help people get enrolled in coverage. So they'll be able to basically stand in as a proxy for an individual and complete an application on his or her behalf. Again, they are funded by the state. They've undergone extensive training, so they're certified to provide this assistance, and they should be credentialed when they come to you. And they are authorized to serve both individuals and small businesses. And then, like the navigators, we have insurance brokers and agents who are, and I should say about the navigators, we have nearly 500 navigators that have been trained. They represent 50 or so, 50 organizations, primary organizations that receive grants from the state, and then about 96 subcontracting organizations. So we have navigators, at least 2 organizations in every county of the state, I think with the exception of Yates County where there was 1 organization. But again, this represents about 500 or so people who are trained and on the ground to provide this assistance. And then we have the insurance brokers and agents. We have over 2,500 of those, I believe, who have completed the training and certification right now. So they're also out there. They can, like the navigators, complete the applications for individuals. Again, they've gone through their training. They can operate in both marketplaces. Unlike the navigators, they are not receiving compensation from the state. Their compensation comes from commissions that they receive from the health plans. And so, again, they're out there and ready to provide assistance. And then we expect also there to be a third class of assisters that are referred to as certified application counselors, and they're in the process of being trained now. With a lot of people to train, so first priority was to get the navigators and the brokers trained. Now the certified application counselors will begin to move through the process. There is no funding stream designated by the state for these assisters. So these are organizations who feel that this work is germane or essential to their mission and it's important for them to do, and so they're involved in this work, but they're not necessarily receiving funding. They're definitely not receiving funding from the state. There may be other organizations out there from whom they get grant funding to do their work, but there was no funding stream from the state to do this work. Again, they go through the same training and certification, and the one other difference is that they will only serve individuals, so they won't be servicing small businesses. So I've given a little information that you see on this slide here, nearly 500 navigators trained and certified. These navigators, we expect to speak about 48 different languages in the communities. So in addition to the language services or access services that are provided through the Customer Service Center, you actually have navigators out there who are speaking multiple languages in the communities. And we have online, and I'll show you where to find this, sort of the site locations. So you'll see a listing of the site locations where these navigators will be in the community. And I believe with that you will see the languages that are spoken at those various sites as well. So I know there were some recent changes, updates to that document, but I believe that the languages are still there as well. So I'll show you exactly where to find that. Again, I've talked about the brokers and certified application counselors, priority being given to hospitals, healthcare providers, health plans, and others in terms of who's being trained first. But there are other organizations that are interested in this work too. And I should say that this is not for the faint at heart. This work, this is real work that people are going to have to do. They're going to have space available to do this work. They're going to have the computers and technology, available to be able to provide this level of assistance. So this is not just for people who just want to promote. I mean, if you want to help do outreach, that's one thing, but this is specifically to help people enroll. Okay. So again, we've talked about the qualified health plans. So both individuals and small businesses have a choice of some high-quality, low-cost health plans. And on the next slide, you'll see all the health plans that have been certified to offer products in the marketplace. And so here they are. I won't sit here and read them all to you. Many of them are the players that you've seen before. And then there's some others that are perhaps new to a particular market. Not all of these health plans are in every county, so you should be aware of that. And when people go on to enroll, they'll get information about the options that they have available in the county in which they reside. And the next slide just shows you the qualified dental plans that are also available in the marketplace. So spend some time looking at those. And again, just like the others, they're not all available in every county. You've heard me speak to or allude to earlier the various metal levels or metal tiers. We call the precious metal tiers here. So we have bronze, silver, gold, and platinum level plans that are available. Each of these levels carries an actuarial value, which represents on average, the percentage of the cost that the plan will pay versus the out-of-pocket for the individual. And so you see at the bronze level, on average, the health plan will be responsible for 60% of the cost and 40% for the individual. Again, this is on average, and 70% at the silver level, and so forth and so on. So individuals will be able to choose which of these plans they would like. And of course, as you can expect, for the bronze level plans, the monthly premiums will be lower. For the platinum level plans, the premiums will be higher, but the out-of-pocket expenses for the individual will be lower. And so this is something where people will look at their particular situations, whether or not they're a person who has high medical need and accesses the medical system or healthcare on an ongoing basis because of some specific issue that medical issue that they're dealing with. Perhaps they'll want to purchase a high-level plan to reduce their out-of-pocket expenses. Someone like me, I see my physician once a year for a full checkup, and that's about it. And so I personally would not purchase a platinum level plan. So, but either way, the idea here is that individuals get to choose what's right for them, what's right for their situations. And all of these various assisters that I've talked about are available to help people to figure out what's best. I mean, they're not going to necessarily choose a plan for you. Again, the consumer is still in the driving seat in terms of making a choice, but they'll provide as much information to you as you need to make an informed choice. So you may be aware that all of the health plans in the marketplace are required by law to cover what we call 10 essential health benefits. And so what you see here are the 10 sort of categories of services that are mandated under the law. There's quite a bit of detail under each of these categories, which I won't go through today, but if you're interested in that information, it is available online as well. And if you have any questions about how to access that, I can help with that. But you can see outpatient services are covered. We have preventive wellness and chronic disease management. In most cases, the preventive visits will be at no charge, so no copay, et cetera. The mental health and substance abuse disorder services are available as well, or required. Hospitalization, you got emergency services. This is something that you should pay attention to. Pediatric vision and pediatric dental are required. Notice adult dental and adult vision are not up there, so those are not required services, although some of the plans will offer it, and so there's some standard plans and non-standard plans. Some of the plans will offer dental, and maybe perhaps that's a way that they will distinguish themselves from some of their competitors or whatever. But those, the adult dental, adult vision are not required. Pediatric dental, pediatric vision are required. Maternity and newborn care, prescription drug coverage is huge. That's mandated in each plan. Laboratory and imaging services and rehabilitative and habilitative services are also in each plan.
Kelvin, would you like to take questions now or later?
I can stop now and take a few questions if you...
I've got one that came in
okay.
and wondering, do I have to pay for maternity and newborn even if I'm beyond my childbearing years?
So these are required services in each plan. I don't know of any situation where they've been kind of separated out. So that is a good question, but these, the Affordable Care Act requires every plan to make these benefits available. So whether or not you're accessing them is one thing, and I know this type of questions have come up because men have started asking those types of questions.
Absolutely.
But to my knowledge right now, every plan must offer these services.
All right. Okay. Thank you. I'm just watching the chat, so if people have questions, they can put that right in to everyone or to me privately, and I can...
All right.
I have one question, and that's, you were talking earlier about how many people have already enrolled fully.
Right.
So that might be really good to share.
Yep, and I plan on talking about that a little bit. So just to clarify for everyone, the New York State site, so New York State of Health, is running fairly smoothly. You know, there are bumps and hiccups everywhere, but really, in general, things are running very smoothly, so people are able to get on, they're able to complete their applications, they're able to get on and shop and actually fully enroll in programs. And so at this point, we have nearly 50,000, I think it's about 48,000 individuals who have completely enrolled in a plan just in these first, since October 1st. And then we have nearly 200,000, I think around 197 or so, who have actually completed an application and qualified for coverage. So that means they haven't actually gone through the process of necessarily selecting a plan that they're going to enroll in, so they're still shopping, but they know what they qualify for. They've actually gone on and completed their application. So quite a bit of interest, and people are getting the assistance that they need. And I know our navigators are quite busy, and things are moving along. So.
Okay. I have two more questions that came in.
All right.
Will my plan be canceled if it does not include all of those things?
Are we talking about
the list of 10 you had on the last slide?
Yeah, I understand. Are we talking about a plan that you currently have in existence? If that's the case, my understanding is both health plans inside the marketplace and health plans outside the marketplace are required to offer these benefits. So if you're in a plan right now that doesn't meet those standards, they're going to have to bring the plans up to comply.
Okay.
That's my understanding. Okay.
Thank you. And
I'll probably answer some of these as we go along, so I may hold some of these until the end. But yeah, let's keep moving forward, and then we'll come back to some of these questions.
Okay.
Just for time's sake, just to make sure that I can cover everything, and perhaps I'll answer questions before you have a chance. You know, questions that have come in, I'll answer them as I'm going along.
Sure.
If not, we'll try to allow some time to cover those. Okay. So from there, I want to move on to the next slide. I've mentioned this before, that the only place where individuals can get financial assistance to reduce the cost of coverage is here in the marketplace. That financial assistance comes in two forms. We're talking about the federal tax credits that are available to help reduce the cost of individuals. I've said before that we expect about 75% of those who come to the marketplace will qualify for some form of tax credits. Basically, in a single adult earning less than $45,960, and families of 4 earning less than $94,200 can expect to earn some sort of a tax credit or qualify for some form of tax credits. In addition to the tax credits, there are also cost-sharing subsidies or reductions that will be available to help lower the cost of co-payments and deductibles, so these sort of out-of-pocket expenses. And again, for an adult earning less than $28,725 and families of 4 earning less than $58,875 will probably qualify for some form of cost-sharing subsidies. Again, these are estimated at the time that an individual applies, and they are immediately available to apply towards the premiums, the monthly premiums. And so basically my understanding of how this works is, you know, when you go in and you put in your information and it tells you, okay, you're going to get $200 a month for your tax credit, you can choose how much of that $200 each month you want to have applied towards your premium. So you may choose, I'm going to apply the full $200. What's not applied, what's not used will come back when you do your taxes as a tax refund. And one of the reasons that people may choose to apply some instead of all of the tax credits, for those people who are worried about what will happen if my income goes up throughout the year, and will I be responsible for paying back that money. This is not a decision that New York State of Health is making. This is something, you know, with the IRS, but there is the potential for an individual having to repay a portion if their income changes and they don't report it and have things adjusted. But so for that reason, some people are choosing to may choose to hold back a portion of the available tax credit. Let me show you a couple of examples of what those tax credits might look like. We'll go on to the next slide. These examples are calculated using a tool that's on our website known as the Tax Credit and Premium Estimator, and you have the website there where you can find that tool. And basically, you know, it's an Excel file that allows you to get an estimate of what things might look like. So for this example, these calculations were done for silver level plans. You see 3 counties here, just for comparison purposes. So for an individual, all of this is for an individual adult, earning $20,000 in Albany County, that person is expected to receive about $209 a month for a tax credit, and that would result in premiums as low as $85 a month with the tax credit applied. Okay. For Brooklyn, you see that same individual earning $20,000 would qualify for approximately $280 a month for tax credit, and then premiums could be as low as $79 a month for that individual. Again, this is based on middle tier health plan selected and the county in which the person resides, rates set by county, so they differ by county. So all of these factors go in. So these are not exact numbers, but it's just to give you an idea of what things might look like. They're pretty close, but not exact. Erie County, you see again, same adult earning $20,000 would qualify for approximately $190 a month for tax credits, and you know, when fully applied, could pay premiums as low as $85 a month. Okay. The next slide just gives you some examples for a family of 4. And by a family of 4, this was calculated with 2 adults and 2 children under the age of 19. And so what you see for this family of 4 earning $50,000 a year, again, these are all silver level plans in Albany County, $307 a month for tax credits, and then you kind of see the breakdown for the premiums, parent premiums starting around $280 a month. Child Health Plus premiums about $18 a month. Okay, so again, I'm not going to run through each of these examples, but I think you get the idea here. And this tool is available, and you all should feel free to access it and use it, play around with it. We've used it quite a bit, spent some time at the State Fair providing information. We used this tool, and it was very helpful for people to get an idea of what things might look like. And in general, I'll say people have been very pleased with what they've seen. This next slide just gives you the idea of how individuals could pay for their premiums. So we know that not everyone has a bank account to write checks, et cetera. So although paper checks are accepted, they're cashier's checks, money orders, electronic fund transfers, and also the sort of general use prepaid debit cards that you see in Walmart or your supermarket or wherever. Those are also acceptable forms of payment. In preparing for this this particular webinar, it was suggested that we might want to think about people who are farmers or seasonal or migrant workers, and just some considerations for them. At the start, I'd like to say that basically what we would like to see is everyone come to the marketplace to see what they qualify for. Issues around immigration, those sorts of things get very complicated, so I won't even pretend to know all of those details or try to answer questions along those lines. But we think that if everyone were to come to the marketplace to see what it has to offer, that's the best thing for them to do. New York State is still working on an anonymous shopping tool on the site that's not ready for people to use right now, but that's something that they're working on getting ready.
So no window shopping yet?
Well, not exactly. I mean, there's information about the plans that are available. There's information about, you have this tool that I just talked to you about, the premium estimator and tax credit tool. That's available already. So these are to help individuals to kind of shop around or look around and kind of get an idea, but the actual tool within the web portal is not yet ready for use, but they're working on it furiously to get it ready very soon.
And if people have employer provided coverage, can they still shop the marketplace?
Okay, so here's the deal. The Affordable Care Act sets an affordability standard, and I should have mentioned this earlier. It sets an affordability standard in terms of how much people should be paying for insurance. So that's capped at 9.5% of a person's income. So to answer your question, if an individual is receiving coverage through their employer right now, so they have employer-sponsored coverage right now, if the coverage that they're receiving is more than 9.5% of their income, then they can come to the marketplace to see if they can find more affordable coverage, and also may qualify for tax credits. Now, the truth is, anybody can come to the marketplace regardless of whether or not the coverage is provided by the employer or not. So if you're coming to the marketplace and you already have coverage from your employer that's deemed affordable, you can still come. You just won't qualify for any tax credits to help pay for your coverage. And so I'm not sure how many situations there will be where you'll find that the coverage that you're getting through your employer, if it's deemed affordable, I don't know how many situations you're going to find where you come to the marketplace and you're going to make out better. So, but yes, you can come. It's a matter of whether or not you qualify for tax credits to help reduce the cost.
Sure.
And I don't know if people understand either. Right now in our current marketplace, insurance marketplace, individual premiums cost approximately $1,200 to $1,300 a month. For a family of four, I think it's about $3,450 a month. Those are what premiums are. And so when you see in the media or some of our press releases points about approximately 53% in the reduction of insurance costs or coverage costs, that's what we're getting at. So right now, coverage is quite expensive, and not many people can afford it.
And the marketplace
resolves that a bit. And on top of reducing the premiums, then there are the tax credits and cost-sharing subsidies that are available. So.
A foundational question just came in, and that's that basically our New York State of Health marketplace is working, and people do not need to go to the federal.
No, honestly, New York State. So let me back up again. So with the passing of the Affordable Care Act, it was established that in every state, come January, there will be an exchange or marketplace that's operational. Many of you may be familiar with the health benefit exchange language. We now use the term marketplace. That seems to translate better to the public than health benefit exchange, just so that there's no confusion. States had the option of designing and operating their own marketplace, entering into partnership with the federal government, or having the federal government completely operate the marketplace within their states. New York State is one of the states that chose to do its own marketplace, design and operate its own marketplace. And so if you're a New York State resident, you will shop in the New York State marketplace, New York State of Health that we're talking about today. You must purchase coverage in the state in which you reside, okay? So there are a few exceptions, and that would be if you are an employee of a small business, for instance, in New Jersey. So you're an employee who lives in New Jersey, but you're working for a small business in New York State that purchases coverage in the marketplace. You could choose coverage through that small business, or you could choose coverage in the state in which you reside. So that's the basic exception there. But really, you purchase coverage based on where you reside.
Yeah. And we reside in New York State.
You reside in New York State, so you don't need to go. We're working well, and you do not need to go to the federal marketplace. We're doing just fine here, and this is where you will purchase coverage.
Very good question.
Yeah, that's a great question. Let's see here. So again, we just want people to come to the marketplace to see what they qualify for. New York State residency, which is kind of established as required for Medicaid and for qualified health plan eligibility. Medicaid and Child Plus have continuous coverage, so that's something that would be, basically it means that insurance for that year, so even if your income were to increase, insurance for that year is still good for those individuals. People should report their expected annual income. So this is particularly for farmers, seasonal workers, migrant workers. They should report their expected annual income. Those receiving tax credits and the cost-sharing subsidies should make sure that they report any changes in their annual income. And it's important that they report their income weekly or biweekly instead of hourly, which is an option, and the number of weeks that they work, just to kind of get the best information and be in the best situation there. We know that there's emergency Medicaid that may be available, so people can apply for emergency Medicaid, if, for instance, they don't meet the eligibility based on citizenship, et cetera. Again, I won't try to get into the complicated nature of that, but there's emergency Medicaid that may be available for them if they qualify for that. So basically, people should be able to come here and see if they can find something that works for them. Okay. We'll move on to the next slide. I won't spend a whole lot of time on this stuff, but we've undergone quite a bit of effort in terms of designing an awareness campaign and multimedia advertising campaign, working with an ad agency and a public relations firm that are helping with these efforts. The name New York State of Health again replaced New York Health Benefit Exchange. And you've probably already seen some of the TV commercials that are running. If you have not, you will, and you will see some of the print media that's already out there. So whether it's in a newspaper or a magazine, those sorts of things, you should see some of those. Online advertisement, you should see we have available our social media sites. We have Twitter, have Google+, we have Facebook, and we have YouTube channels that are currently functioning, and people are using it quite a bit, actually. Twitter and Facebook especially, I think people are using quite a bit to ask questions, and those questions are being answered. So every question that is posed on those sites, someone is responding to those questions that people are asking. You see out of home there. By out of home, we refer to, we're talking about billboards, transit, bus shelters, those types of things. So you'll see those. And radio you'll start to hear as well. So we're doing quite a bit to try to get the word out to make sure that, so in addition to our being out in the communities and the navigators and these sorts of things, we have all of these efforts underway to help people to know about this. All right. So as you are service providers and you're out in the communities, just wanted to think about how it is that you might be a resource and help people to avail themselves of this information, and how you might direct them to where they can get the assistance that they need. And so moving on to the next slide, you may serve as a community resource. You may share information and knowledge, whether it's churches using their bulletins, their church bulletins, or bulletin boards, or various avenues to get information out, or your organizations hosting information on your website, sponsoring links, etc., or taking information to events that you attend, whether they're health fairs or whatever type of community events you're involved in. Those are some ways that you can get information out. You can also just be a resource center distributing some of our materials that are available. I'll show you later on the materials that we have designed and that are available in our distribution center and how you can place an order for them. They are free. There are some limits in terms of quantities that can be ordered because we don't have an unlimited supply. We want to make sure that everyone trying to get information can get it. Of course, we'll continue to replenish our supply, but there are some limits set for the particular pieces of collateral that you might. But I'll show you the order form, how to access it, and you send that in. Those orders are being fulfilled, and again, it costs you nothing. So you may just choose to order some materials to have that you can distribute. You may also help to just identify other outreach partner or opportunities for us, places where we should be to kind of get this information out. We have a fairly small outreach team at the state, but we're doing our best to cover a lot of ground. We can't be everywhere. We can't do every event. In some cases, our navigators, for instance, might be out doing some of these speaking engagements and some of this outreach stuff for us. But we're doing our best to get the information out to people as possible. You might choose, again, to invite one of your local navigators to come to your organization to present. So they can certainly answer a lot of questions. They have, again, extensive training. And you might even talk with them about using your location as a site where people can get enrolled. Let me say this about the enrollment process. On average, we're expecting the application to take about 45 minutes. On average, again, it may be more or less depending on the individual or family circumstance, situation to complexity, whether or not they're trying to get financial assistance. So all of these sort of things play into it, whether or not they have an email account, something as simple as that, you know. But all of these things kind of figure into the time. But in general, the application process we're thinking takes on average 45 minutes for completion. So we'll move ahead now. So the website, NY State of Health, so www.nystateofhealth.ny.gov. That's our official website. I'll show you what that looks like in another slide. Again, you may choose to link to our marketplace on your home page. For those who come there for information, they can easily access the information. Again, some of the other resources that we have on our site you might choose to link to or just have placed on your site. So list of navigators and the subcontractors in your service area. So the tool that I talked about, the tax credit and premium estimator, all of those tools, those types of things you might have available for those whom you serve. Okay, we'll move on. So here's what the website looks like when you go to nystateofhealth.ny.gov. This is what you get. And so you can see there's a place for individuals and families, for employers, for employees, for brokers, for navigators, different access points for them into the web portal. Click on the Get Started button and kind of walks you through the process. But again, no one should feel that they have to do this alone. We have assistance provided in person and also over the phone for those who need it. Next click. Okay. I've talked about some of the tools that we have available. So in terms of our printed resources that are available through our distribution center, we have fact sheets, we have rack cards and posters, and I'll show you samples of those in English. That's what's available right now. We are working right now to get the other languages, the materials for the other languages in the distribution center. They are all available and as downloadable PDFs on our website right now. So all of those languages are available right now for all of those materials on our website. So you can download those and print as many as you like. We are working to have all of these languages available in our distribution center for you to place your orders very soon as well. So that should be coming very quickly. We have newsletter inserts, so if on your website you wanted to drop some copy in, you don't have to worry about writing it. It's already written. You can just take it and drop it there. If you send out a newsletter on paper or an e-newsletter, or you have a blog or something where you want to put some information, we have newsletter inserts available on our website. You can just take that information and use it. There's a list of navigators by county. Yeah, you can access, so there's a navigator map, actually. You can click on your county, and it'll bring you all of the navigators that are in that particular county. And the same is true for the health plans. There's a health plan map. You click on your county to show you all the health plans that are available as options within that county. We've talked about the estimator tool. There are also some regional fact sheets, so if you're trying to get a little bit more information about the specific area or region, it's not going to be city-specific necessarily, but, you know, what things look like in your region in terms of the uninsured and who's coming to the marketplace. Those are also available on the website. Okay. So here are the materials. So on the left here you see one of our fact sheets, why it's now easier to pay for health insurance. And then in the middle you see one of our rack cards. That's the one for the small businesses. And there's information on the back also of those. And then you see one of our posters. That poster that you see is one for our young adults, that's targeted to young adults. And those posters come in 8x10 sizes, and then you also see larger versions. I think the next slide talks a little bit about the various materials if you want to switch to the next slide there. So that shows you the rack cards. They're 4x9, they're double-sided. There are two versions, one for individuals and families, one for small businesses. The fact sheets, 5 versions: small businesses, young adults, immigrants, value of having health insurance, and paying for health insurance, why it's easier. So those are the 5 versions. These are 8.5x11, single-sided. And then there's the posters, 2 different sizes, and 3 different versions: individuals and families, small businesses, and young adults. We're doing our time here. Here's the order form and where you can access it on our website. So basically you fill it out, you send it to the email address that's there, and within a day or two you should get confirmation that your order has been received and being processed, and it'll give you an estimate of how long you should expect to wait for your materials to come, and it's not that long. So generally about a week or so, or a week, maybe 2 probably at the most, but generally about a week or so they're fulfilling the orders. So you can access that. I've mentioned a navigator site, schedule, or location. So this is kind of what this looks like. So for instance, as you see in the first, at the top here, in Albany County, and these are listed by county, every navigator organization. So Healthy Capital District Initiative is one of the navigators. It shows you that they are going to be at Cahole Senior Center. It gives you the address, it gives you the phone number, and then it shows you the languages that are spoken by the representatives that will be at that particular site. Now, if you were to go down the list, you may see several other locations for that same navigator organizations. So that's not the only site necessarily where they'll be available. This is, and you can see that Community Service Society, Gilderland Chamber of Commerce shows you they're going to be at Bethlehem Town Hall, and then the next one shows you that they're going to be at the Gilderland Chamber of Commerce, that actual location. Again, languages. The next one down shows you that where they're going to be at the library. So you'll see multiple listings for the various navigators. But just to give people an idea where they can find the navigators, it's very important to call. You know, these sites, locations, these will be updated monthly, and so it's important to make sure you call to make sure that they're at those locations. I think right now they have their hands full, and for the most part they're taking appointments. So people call and make appointments, and they can go and meet the navigators. Next slide just shows you the health plan map that I referred to earlier. I won't spend any more time on that. Similarly, there's a navigator map. Okay. And also, this is just a tool that's on the website. Again, we're talking about people being able to kind of shop around and get some information in advance of that anonymous shopping tool being available. This just lists all of the health plans and a link to their provider networks, so you can be able to access information there as well. This is the regional fact sheet that I mentioned to you, and it shows you the regions where it's currently available, but that's what that looks like. And so that's something that you can access. All right, next one. This is what the tax credit and premium rate estimator tool looks like. So basically, I know it was just updated, and I haven't been on it since it was updated a day or so ago, but the basically you enter information about your household, the number of individuals trying to get coverage, number of adults, number of children 19 to 25, number under the age of 19, annual taxable income, so you're putting that information in your county where you live, you're choosing a plan level, then it shows you your tax credit that's available, shows you where you fall on the federal poverty level, and so you probably can't read this very well, but at the bottom it's showing the tax credit that's available. For this example, I think it's $269.84 that person would expect to receive in tax credits. And then once you scroll down further, which you can't see here, this is just a screenshot, it would show you all of the health plans in your county, and it would show you what the premiums would be without the tax credit applied. If you applied the full tax credit, then it shows you what the premiums would be, and so you get to choose. But again, just to help people get an idea of where they should fall.
And somebody's asking about the cost sharing versus tax credit. Can you explain the difference between the
Again, the tax credit is, again, based on your income, where you live, your family size, et cetera, is money that the federal government is making available to help cover the cost of your monthly premium. So that's to reduce the cost of the monthly premium. The cost-sharing subsidies are to help reduce some of the other out-of-pocket expenses like co-pays and deductibles. So that's an additional resource that's available. Again, not everybody's going to qualify for tax credits. Not everyone will qualify for the cost-sharing subsidies. I think if you back up to one of the slides there, it shows you sort of, give you an idea of the income levels where people might qualify for either of those. Again, I said earlier that we expect approximately 75% of those coming to the marketplace will qualify for some form of tax credit, and for an individual making, I think it was under $45,900, they could expect to qualify for some form of tax credit. Basically, if you are at or below 400% of the federal poverty level, most likely you'll qualify for some form of tax credit. And then you saw the levels also for the cost-sharing subsidies. So the difference is tax credit to help reduce the cost of your premium, cost-sharing subsidies to help reduce out-of-pocket expenses, co-pays, deductibles.
Great.
Okay.
Thank you for the clarification.
Sure. This next tool is also important. As you can imagine, there's been some concern about whether people will try to take advantage of individuals with this new thing here. And so we have a consumer fraud alert on our website that you can use. You can certainly download that and share it with your consumers or constituents, people whom you serve. Basically, you should know that no one should ever be charged to receive assistance. So no one should charge anyone to receive assistance. So navigators won't charge, brokers won't charge, insurance agents shouldn't charge, certified application counselors will not charge. And let me also mention, too, while I'm talking about the assisters, many of the federally qualified health centers have also received funding to provide assistance. So along with our navigators, they've also been trained. So that's yet another resource within many of their communities where people can get assistance. So they've received money from HRSA, Human Resource Services Administration, to provide assistance, and a lot of them have also received funding from CMS, Centers for Medicare and Medicaid Services, to help with outreach and that sort of stuff around this. So that's another resource that I did not mention earlier that's available to help individuals get enrolled. But I know, like the health centers that receive funding, they've been trained along with their navigators, so they've actually had staff trained too, so they're available in the communities. But individuals should be credentialed. They should not be charging. Those are two real basic things. And if in doubt, don't give your information to anyone just coming and knocking on your door. Go to your trusted sources, verify that these individuals are people who should be coming and helping you. But, look for the badge, look for those sorts of things. So just make sure you're dealing with people who are credentialed. And again, never pay anyone to provide this assistance, because no one should charge anyone for this assistance. Health plans are receiving, the brokers and agents are receiving their commissions through the health plans. The navigators are funded through the state, so there's no reason for them to be taking any resources from you. But download this tool and feel free to use it. So in closing, coming to a close here, New York State of Health, we like people to know is the online marketplace offering New Yorkers a gateway to affordable coverage. Comparing and finding the right plan for you and your family has never been easier. We've done everything we can to remove the hassle. You can choose from a certified group of health insurance plans, giving you the peace of mind that you are prepared for life's events. The last slide here that I want to show you is I talked about the application being about 45 minutes on average. On our website, you can find a demonstration of what the application looks like, the types of questions that are asked. This is not the full 45 minutes. This is about 18 minutes or so. But and some of the information has been pre-populated. But just to give you an idea of what the application process looks like. There's one available for individuals and families. There's also one available for small businesses. So feel free to take a look at that. It's on our website. Again, here's the web address, and www.nystateofhealth.ny.gov, and the customer service call center number 1-855-355-5777. That is a toll-free number. It begins with 855, but it is a toll-free number. Okay? And then this next slide, I will let Jennifer jump in just to kind of inform you about something that's coming up.
Yeah. Well, thank you so much, Kelvin, for this really comprehensive introduction to this process that's going on in New York State. A follow-up event that has been really sparked by Cornell University's Government Affairs and Community Engagement and Communications folks is an Affordable Care Act 101 forum that will be on site at Tompkins Cortland Community College on the 5th of December. And they see Cornell Cooperative Extension as a tremendous partner in this. We're hoping that a lot of people can join the event in person. There will be panels. There will be, lots of information from people who have gone through the enrollment process and can talk about it firsthand. Local Tompkins County navigators will be talking about their work and their experience. We should have some representatives from the state and federal people who are staffing and developing the Affordable Care Act and the marketplaces. And we also will be providing downlinks to any Cornell Cooperative Extension associations that want to stream it live. And stay tuned. There will be more on this, and I believe that there will be subsequent webinars for maybe more specific questions around, say, farmers' interests, agricultural enterprises' interests in terms of the Affordable Care Act. So thank you again, Kelvin. And
thank you, and I'm happy to try to entertain questions. I don't know how much time we have available. People can hang around for a little bit. I will do my best to answer questions. Just be aware that I'm not an eligibility and enrollment expert, so when you get down to some of the nitty-gritty, I may not be able to answer some of those questions. And I don't know, do we have the ability to take all of the questions that have come into the panel here and save them somehow?
Yes.
So that if there are questions that I'm not able to answer today, perhaps what I'll be able to do is take them back, and I'll send them back out to Jennifer, and perhaps we can push them back out to you at a later date.
Will go to everyone who was registered.
So I'll do my best. So I know we're over on time, the time that was initially allotted, but I am going to try to take a few questions if you have some.
Okay, so if you need to get off the webinar, you're welcome to do that, obviously. But we'll stay on just for a few more minutes, and I can go back to the chat. So some questions have come to me privately, just depending on what was selected, and I'll see if we can organize that. So are surgeries covered under the hospitalization part of the coverage?
Let me see if I can go back to the details there, but I think
want me to click
that should be fine. Let me just, no, I'm just trying to go back to some detail that I have here. So, so under hospitalization, we have inpatient hospital services, inpatient physician, and surgical services. So yes, skilled nursing facility, delivery, and all inpatient services for maternity care covered under hospitalization.
All right, and another, I don't think we addressed this, are individuals who qualify for Medicare may enroll any month of the year?
So let me, very, very important question, and again, one that in my haste I perhaps skipped over. It was Medicare, and that's exactly why I want to address it. This marketplace, the New York State of Health, is not a place for people to come for Medicare. So available in the marketplace: Medicaid,
Okay.
Child Health Plus, qualified health plans, and dental plans. Medicare, this is not a place for individuals qualifying for Medicare. You cannot enroll in Medicare through New York State of Health.
Okay. And you mentioned dental insurance. Can you sign up for dental insurance on its own, or do you need to also have health insurance from the marketplace to qualify to sign up for dental?
You may also qualify for standalone dental plans.
Okay.
Yes.
That's great. I just heard my son's was canceled because of his age. Are tax credits available to people covered through group employer plans?
Through group employer plans. So if you're in you have employer-sponsored coverage right now, if I'm understanding correctly.
I think that's the question.
Tax credits would only be available to individuals who choose not to take their employer-sponsored coverage because the coverage that they're paying for exceeds the 9.5% income cap that has been set, the affordability standard that I spoke of earlier. So individuals are not expected to pay more than 9.5% of their income towards health care. If you are paying more than 9.5% of your income for your employer-sponsored coverage, you can then come to the marketplace and qualify for tax credits, perhaps.
Okay.
Not necessarily. It's not a guarantee that you'll qualify for tax credit. You know, there's income and all of those types of things that need to be taken into consideration. But that's the only way that someone with employer-sponsored coverage will qualify for tax credits if they were paying more than 9.5% of their income towards that employer-sponsored coverage.
Great.
Okay.
You are a wealth of information.
I'm doing my best.
I have one more question here, two more, I guess. Another one's popping in. If we haven't answered your question yet and you're still on the line, please enter it into the chat, because as I'm looking through, I think we got most of them. So this question is, how can we sign up as a site for the 101 forum? What's that?
There is not a registration process in place yet. What I suspect the process will be is something formal in terms of the downlinks, and then first come, first serve in terms of the on-site forum. The room that we have at TC3 accommodates about 160 people. You know, we're hoping to fill it. I don't anticipate that we will overfill it greatly. So stay tuned. If you're registered for this, you will get, you know, sort of priority information on this, and we will also be sending out information to the complete CCE email list.
Okay.
And that's Jen Tiffany, just to remind everyone, our Associate Director for Cornell Cooperative Extension.
And you might be surprised about how many people come. I did a forum for agencies in Binghamton, and big crowd.
Wonderful.
So you may get a lot of
We're
people.
hoping a really big crowd, and
we're
hoping for spin-off events.
Yeah.
Great. And one follow-up question here is it 9.5% of gross income or adjusted income when you're talking about the employer?
I think we're talking about modified adjusted income.
Adjusted income.
Yeah.
Okay.
Modified adjusted gross income.
I think all the questions here are covered, and we appreciate everyone who is on the line and asking questions and participating today. Yeah. And thanks so much to you, Kelvin and Jen, for pulling it all together. Appreciate that.
Thank you all.
Really appreciate Kelvin's stay-with-itness in terms of the traffic issues this morning.
Yes.
You know, it was thank you so much for being willing to come here and share this information.
I'm glad that I could, and we're just grateful. We think your organization, you're in every county of the state, and so who better to partner with? You're out there, you're serving people, you're reaching the people that will likely need this information. And as far as I'm concerned, everybody needs the information. People make the decisions that they need to make, but in order for them to do so, they need the information. So we're doing our very best to get the information out to people, and we think that there's a role for you to play in assisting with that. And so we're very grateful for the opportunity to partner with Cornell Cooperative Extension. So thank you all very much.
Great. It looks like the recording has been recording, so we'll double-check that, and as long as all that works, we'll get that posted, and we'll let everyone know who's registered where the resources are.
Yeah, and we're hoping to post it to the public site.
That's right. We're working on that also.
Great.
Okay.
Okay.
Thank
you.
Thanks
so
so much.
Celeste. Yeah, Kim.
That's okay.
See, now I'm recorded. You know, it's like I'm documented as a space cadet about names, and everybody knows that already.
Not a problem.
Yes, yes.
Not a problem. Okay, we're going to turn off the recording and end the meeting. Thank you, everyone.